Sex is part of our life. Apart from the pleasure, it creates bond among partners and also have a positive effect in our health by boosting our body immunity. But as important as sex is, there's a kind of condition you may find yourself that you need to stay away from sex. Let's quickly talk about when to avoid sex. If you're just watching us for the first time, kindly subscribe, like and share this video so that this information can get to many people out there. Number one is when you are having infection, sexual transmitted infection. If you notice that you started feeling any sign and symptoms of infection within your body system, this might be a sign of discharge from your vagina or vagina itching or any other thing like painful urination. If you notice any of these kind of signs, discoloration of discharge within your vagina, this is a sign of infection. It's better you skip sex and get checked. Number two is immediately after surgery and delivery. Yes, medically it's advisable that a woman that just gave birth, you should stay at least 6 weeks before getting involved in sex. And also if you undergo a surgery, pelvic surgery, you need to stay for like 6 weeks before you go back to sex. This is to prevent infection and also give your body a time to heal from the injury before you go back to sexual life. Therefore, sex after delivery or immediately after surgery is not advisable because it might result to a series of complications, thereby getting infected as a result of sex. So you need to stay away from having sex immediately after delivery till after 6 weeks. Number three is painful sex. If you notice that you normally feel pain during penetration or you notice a severe pain within your pelvic region, this might be a sign of fibroid. This might be a sign of infection, series of infections in your body system. It might also be a sign of endometritis, and inflammation of inner lining of your uterus. These are the things that you need to know, that if you feel pain or you normally feel pain during sex, during penetration, you should stay away from sex until you get yourself checked. Number four is severe vaginal bleeding. If you have episode of vaginal bleeding, involving in sex will worsen the condition. It might be a sign of uterine fibroid. It might also be a sign of endometritis and series of infection within your body system. So if you have any episode of bleeding through the vagina, stay away from sex until you get yourself checked. Number five is genital wound or cut. We all know that during delivery, sometimes we normally have a cut and we call it episiotomy. And also, as a man, if you have any injury or a cut within your penis, you have to stay away from sex in order to prevent infections and also allow your body to get healed, because this might change the state of your vagina. This might result to complications. So if you have a cut or a genital injury, please kindly stay away from sex so that you will not get infected. Number six is during severe illness. There are some kind of situation you may find yourself that you need to stay away from sex. Situation like heart diseases. If you have an episode of heart attack, and your heart, you notice that your BP is not normal, it's fluctuating, and you notice that your heart is not in a normal condition, at this moment, you need to stay away from sex until your body becomes normal. Remember, sex should be enjoyable and safe. There's no pleasure in getting infected from sex. So let's stay away from sex if you notice any of the above mentioned signs or conditions. It's better you reach out to a doctor to get checked before you go back to your sexual life. Don't forget to subscribe, like and share this video.